I'm Dr. Lisa Hunter, Senior Clinical Director of the Division of Audiology. Our staff of 40 audiologists are experts in hearing and balance healthcare, and we are here to serve you in the community and beyond by offering expert hearing healthcare to your child and family through systems that put your family first. The sense of hearing is one of the most important ways that babies and children learn about the world around them. Even before birth, babies are able to hear, and so they come ready and equipped to learn by listening to your voice, to your singing, and to soft environmental sounds like birds chirping.
Audiology is the diagnosis and treatment, non-medical diagnosis and non-medical treatment of hearing loss and balance disorders.
It's a study of hearing. So you've got, medical doctors or ENTs who are ears, but the study of hearing and the evaluation, the rehabilitation, that's audiology.
To me, the first thing and foremost thing is a helping profession. It's very, very rewarding. You put a hearing aids on a young baby or someone who hasn't heard sounds for a long time, that moment, their eyes light up. That's just priceless.
The profession of audiology has over 12,000 members. Audiologists must be licensed within the state they are practicing, and they should obtain professional certification. To be licensed in the state of California, audiology applicants must hold a doctorate degree in audiology from an educational institution approved by the board. They must complete 300 hours of supervised clinical practice with a wide variety of ages and communication disorders under the direction of an educational institution. They must submit evidence of no less than 12 months of satisfactorily completed supervised professional full-time experience or its part-time equivalent. And they must pass a board-approved examination.
It's challenging. It's a challenging profession. It's a challenging set of curricula to undergo, and it's quite technical and much more quantitative than, say, something like speech-language pathology.
Hi, my name's Amanda Fitz, and I'm an oral rehabilitation audiologist here at Cincinnati Children's Hospital. Oral rehabilitation is a type of therapy that is for children with hearing loss to assist them in the development of their auditory or listening skills. It's sometimes referred to as auditory training or listening therapy. Children are typically referred for an oral rehabilitation evaluation once they've been identified with a hearing loss. Their managing audiologist would inform the family of the hearing loss, go ahead and fit them with some type of amplification, whether it be hearing aids or a cochlear implant or some type of assistive listening device. And then the child would be referred for an evaluation of their auditory skills. Oral rehabilitation therapy typically is a weekly process and lasts 50 minutes in length. However, that is dependent on the child's attention level and the availability of the family. We do reassess on a consistent basis to determine whether or not continued therapy is necessary or whether the child is ready for discharge.
In general, the recommendation is around the age of 50 to have just a preventative hearing screen. The sooner, if you notice that you're having difficulty.
Dr. Greta Stamper is an audiologist at Mayo Clinic. She says one difficulty in particular tends to finally get patients into her office.
They realize they're not understanding their grandchildren, or they miss something that one of their grandkids said.
Dr. Stamper says if an exam does reveal a problem, a hearing aid may be the recommended remedy.
A lot of people think that, I'm still able to hear something. That means that I don't need hearing aids yet. But the thing is that hearing aids can provide a lot of benefit, even when you still do have a good amount of usable hearing.
It's a small piece of technology that can have a big impact, whether you're watching your favorite show or talking to your grandchild. For the Mayo Clinic News Network, I'm Jeff Olson.